Yes, thank you so much, and hi everyone. So let me now share my experience with Peginex. As everyone knows that I've been treating most of my patients with complications like PCVs with Visudyne since last 20 years. And I've become so much confident with Visudyne and PDT and doing combined therapy that I did not think about using Paginex in most of these patients. Still, the Visudyne was not available. And that started in February, early February 2021. And then I had no option but to, view another molecule because I've tried all other ones and I realized that they do not act as well as what I'm used to. So let me start my presentation with a patient who was 56-year-old, and she started coming to me in 2016, and this is how she presented. And huge PEDs, and I was doing combined therapy at that time. And these are the kind of results that I was getting, and the improvement in vision. And after 1 year, she again developed the same kind of thing. Again, I did the combined PDT, and very good results. Now this is before, again after 1 year, and after PDT again it subsided. Fourth time she developed the same kind, again I did PDT. Now this is after PDT in 2018, and even after 4 combined therapies I could still have vision which was as good as 6 by 6. And the patient was doing very well and very happy. And then she started coming, and there was, if you can see here, there was some membrane developing in this area. And but now I did not have PDT because Visudyne wasn't available. And this is the time I gave her injection of Avastin. She didn't do well at all. The membrane was still increasing, if you see here and here. Gave another injection of Avastin. The membrane is now becoming stronger. And that is when I said, no, I have to try this new molecule. And this is when, this is again after third Avastin, and now the membrane has become stronger and things are becoming slightly bad here. And this is before Peginex. And this was the patient where I got so enamored by this drug. And I noticed in all my patients, I've done about 37th injection I gave today, because I started quite late. I was scared of the vascular and the inflammation and all those reports. I kept talking to the company, but I did not have a heart to start using this drug. But in early February, I did actually. So even the membranes, it has a lot of effect on the membranes. So let me go over to more patients. This is 75-year-old male, where this is before Peginex. And if you see here in OCT angios, there are so many of these, PEDs. And this is after one injection, the vision is become better and the patient is looking much better. And this is an old scarred kind of lesion. This is another patient, lots of PEDs here. It's so important to look at all these OCT angio pictures to really know what this drug is doing all over the place, not just the central macula, drying up, but to all other PEDs and a lot of things, which we could not even cover with our PDTs. So the things have become so much better here, and this is after Peginex, and the patient is looking much better. Now, this is another 80-year-old female where there was a huge PED, and if you look here at the lot of polyps here. But after one injection of Peginex, the macula is becoming better. There are some exudates, but it's much better. And the PEDs become smaller now. And look at these polyps. The polyps have just disappeared. The whole area was full of polyps, and now they are just in this area. This is another patient. There is a Shrem here and PD, and this is how the OCT angio was looking. And just after one Peginex, this is looking much better. After second Peginex, the things are even better, but the PED is yet to resolve in this. Now, the same patient, this is pre-treatment, this is after first Peginex, and this is after second Peginex. And this patient got the third Peginex yesterday. So I'm yet to see the result because this PD as yet has not resolved. So another patient, 42-year-old female CNVM, 624, vision. And then I became more confident. Now, this is a simple CNVM where perhaps eccentrics also would have worked. But, having been confident, I've started giving this option to all my patients. And this is how the patient looks after Peginex, pre-Peginex, and this is post-Peginex. The patient is much better. Another 65-year-old male. Now, this is a patient where I had done PDT. These are the polyps you can see here, the polyps. And in PDTs, I was just looking at the polyps and just treating the polyps. And this is how the patient was after treatment with PDT. The patient just kept coming and I kept giving the eccentrics. And this is after treatment with the third eccentrics till the patient was developing PED again. And this is before treatment with Peginex and after treatment with Peginex, where the things are looking much better. Another 57-year-old female. Now, this is a high myopia patient. And again, this is, because we are becoming very confident with this. So this is one option that I'm giving to all my patients now. And the thing has really improved with this. Another 62-year-old. If you see here, and this is after Peginex, one injection, the patient has already got the second injection Peginex. In this, and 40-year-old male, I'm going very fast because I just have about few seconds left. This is after first Peginex, and things are looking much better after the second Peginex. Another 74-year-old male. Now, this patient had come from far, so I just told them to send me the OCT. So the OCT was done somewhere else, and the patient has really improved, and the patient is very happy, of course. This was the original lesion, and after Peginex, the patient is really. This is another lady who's had in the left eye a very scarred retina, and she's a gynecologist. And this is how she looks just after one Peginex, a bad retina, but it's really, really improved. And she has lots of drusen maculopathy and dry maculopathy. Just my last slide. This is a patient who's had lots of eccentrics, injections, and some PDTs. But as I noticed, there were some membranes developing somewhere, at different places, which are still very active. With Peginex, the central vision has remained the same, but these membranes just disappear on OCT angio. So the results of my last 30 patients have increased my confidence. And now I just started using it in even diabetic patients also. Thank you. Thank you.
Thank you, Indu, for showing wonderful pictures. And very happy to see that a lot of your patients are improving on Peginex. And are you still waiting for PDT to come back, or you have sufficient confidence?
No, I have sufficient confidence now.
Yeah,
yes.
Yeah. The reason I was asking was because Visudyne, I don't know when it will become available. But as of now, in all these patients with IPCV, we have to depend on monotherapy with this.
Absolutely. No, but this drug is really doing very well. I'm very confident now.
So has it become number one drug for you, or are you still using resistant patients?
This has become number one, although I'm slightly skeptical about the inflammation part. I haven't had inflammation as yet in my patients, but I'm slightly skeptical. So in BRVOs, I'm using it with caution. Not many patients, but in diabetics and AMD, yes. In AMD, it's become my number one drug. Yes.
Diabetics, so I haven't used it actually. Prashant, what is your take on this?
AMD sir, this is off-label. Basically, the
your audio is breaking up, Prashant.
Is not yet approved, but yes, few of the patient like any other anti-VEGF, I have been using it. Can you hear me, sir?
Yeah,
Hello.
now better.
Hello.
Yeah. Carry on.
Yes, sir. I accept FDA has not yet approved this particular drug for indications beyond AMD, but I have experience with CRVO-related macular edema, diabetic macular edema, and predominantly they are the patients of doctors' parents, parents or something like that, who can understand the ifs and buts about using it off-label.
Ramesh,
And they do well. They do
Ramesh,
well, of course.
Ramesh.